Welcome back to Champion News Talk Radio, brought to you by championnews.net. This is Carol PARISI. Our founder, Jack ROESER, and myself have our great guest with us, Mr. C. Stephen Tucker, the expert on health care. And Steve, during the break, you said something about millions of people losing their health care. That can't be true. This is supposed to put millions of people on health care.
Yes. Well, if you blindly believe President Obama, who said if you like your plan, you can keep your plan, and no one will take it away from you, period.
Who called him a liar? Or not true?
Well,
was it Joe?
Joe Wilson was the first, and then our own Joe Walsh was the second, right from his office in D.C. But both men were true. Both men were speaking the truth. Barack Obama has lied on this issue and many more issues, but specifically this one. And we know this now.
Did you say that the President of the United States lied?
Yes. Yes, he is, in my opinion, a pathological liar.
Steve, you mean our listeners could potentially
Steve, you're
lose
a man
their health care?
of a temperate attitude, and I ask you that because I think your opinion is worthwhile. You're an expert in this field. You make your living out of it, have for a considerable time. You're successful at it, and but in the times we've talked to you on this program and otherwise, you've been, well, more of a statesman than our president, for sure.
Most people are.
This is, think how vital all of this is, in the sense that the single-payer systems don't work out for us consumers, do they?
No.
It hasn't worked out with education. Tell us a little bit about how the system works presently and how it's really going to change under Obamacare.
So here's what's coming. What's not being reported in the media and hasn't been reported is that thus far we have had 13 health insurance companies that have exited the individual and family health insurance market.
13 companies.
13 companies. One of them right here in Illinois, Guaranteed Trust Life, they're up in Glenview. They were one of the first ones to exit the individual market. Now, when an insurance company goes out of business or exits the individual health insurance market, what happens to their policyholders? They lose their plans, right? So back in 2010, when they began the medical loss ratios, Barack Obama still today is saying medical loss ratios are great. You get a check back from the insurance company.
What are medical loss ratios?
The medical loss ratios were a part of the law that said if you're a health insurance company and you underwrite more than 50 people, you must, by January 1st of 2011, lower your entire operating margin, not your profit margin, your entire operating margin down to 15% or less. Okay? If you underwrite less than 50 people, you have to go down to 20%. So most of the smaller carriers operated on razor-thin margins. Okay? They were at 25, 30, 35%, some carriers. All of a sudden they had to cut down to 20 or 15. They realized they could not do that in the short amount of time allotted to become compliant by January 1st of 2011. So they simply exited the individual market.
Now, what is the difference with the individual market versus a group plan market? They're still in a group plan market, but individual people cannot buy insurance through these carriers any longer.
That's correct.
Okay.
And they lost their health insurance plans, okay? This is a letter from Guaranteed Trust Life that my clients got all over the country. And the letter states that they will be losing their health insurance plans. And it says, will I be offered a replacement plan? Yes, we're required by the law in terms of your policy to offer you replacement coverage. I'm reading from the letter. The replacement will be a high deductible major medical plan. This type of plan doesn't begin to pay for covered charges until such charges exceed your new deductible of $25,000 per person. Now, the person who got this letter lived in Naperville, who was a client of mine, who bought a policy from me more than 10 years ago that had a $5,000 deductible for the entire family.
$25,000 per person.
She lost her plan, right, in the middle of breast cancer treatment. And she had put money aside in what's called a health savings account for many, many years, right? She was healthy all those years. She loses her plan on May 1st of 2010 in the middle of treatment for infiltrating ductal carcinoma, could not afford a $25,000 deductible for family. So I had to move her from her plan that she lost onto our state high-risk health insurance pool. Now, this is the damage that's been done since 2010. So starting in a week from today, on October 1st, millions of Americans around the country will start receiving letters from their insurance companies. Now, the letters are going to come from 3 carriers in the state of Illinois: Blue Cross Blue Shield of Illinois, Aetna, and Humana. And these letters, and I have them up at truthaboutobamacare.com so you can see advanced copies of them, are making these Humana Aetna and Blue Cross clients aware, these are individual family policyholders, not small businesses, individual family policyholders.
Not big businesses.
Not big business, individuals. They have two options. They can either keep their existing plan, right, until December 31st of 2013. At that time, they will have to have their policy fundamentally transformed, which means it must include all new 10 essential health benefits that are coming under Obamacare that business plans already have. In these 10 essential benefits are things like drug rehab coverage, are things like maternity coverage with no waiting period, even if you're 9 months pregnant. Whenever the government piles on mandates onto health insurers, it drives premiums up. So all these people are going to lose their existing plans. They're going to have to get an Obamacare approved plan by December 31st and pay the rate increase that's coming, and it will be substantial.
Percentage-wise, what type of substance?
We don't know yet. We're waiting for the fourth quarter premiums to be released to the Department of Insurance so we can say, here's how much it is. But I can guarantee you this, it won't be less, because you can't put 10 new mandates on a policy.
You know what? I
and
don't
rates go down.
understand why a 70-year-old couple would need maternity coverage.
They don't.
Or drug rehab coverage.
They don't.
What is this that you have to have all of this buffet of stuff that you're never going to use? That's a waste.
These are government, state, and federal agencies that put mandates on health insurers, and they force them to cover things that are not medically necessary. So let's go back to 1979. In 79, there were a total of 252 mandates placed on all health insurance companies in all 50 states, or 57 if you're Barack Obama. Now, fast forward to the year 2009. There were a total of 1,900 health insurance mandates placed on every carrier. Fast forward post-Obamacare, today, there are over 2,262 mandates on health insurance policies, and you can see them all at truthaboutobamacare.com. You'll notice as you're scrolling through the list that things like hair plugs are mandated to be covered.
Joe Biden put that one in for himself.
Health club memberships, right? Massage therapy, right? Infertility. And now we have maternity on every policy, no waiting period for no extra charge. Well, these things are not free, okay? We've already added 65 preventative care tests, things like a colonoscopy that Barack Obama sells as being free. It's not free. Somebody has to pay for it. That's a $3,000 test minus facility charges. So what happens? The carriers just raise the rates. Okay, but here's how Barack Obama is going to hide all those costs. All right, as of 10/1, when you go into the health insurance exchange, if you make less than $46,000 a year of modified adjusted gross income, which is after taxes, after retirement contributions, you're going to go in the exchange. Let's say you're a family of four. The average income for a family of four in 2012, according to the U.S. Census, was $51,089. Okay. So you go in the exchange, and what you'll see initially is the real cost of Obamacare qualified health plans, gold, silver, bronze, and platinum plans. The bronze plan, the cheapest plan for a family of four, depending on where you live, will cost between $16,000 and $18,000 a year. Okay, very expensive.
Well, that's what Jack is paying
That's
for
what
his
Jack's paying
employees
now, right?
now.
Okay,
His
now you're
company.
going to put your income level in at $51,000, your number of members in your family, and hit enter. And what will happen is the taxpayer will be providing what's called an advance premium tax credit. It's money right away to lower that premium artificially. So they'll actually going to pay about $3,000 a year, even though the cost is $16,000 a year, because the few, the proud, the 51% of us who pay income taxes in this country will be subsidizing it. And it doesn't go to them, it goes to the insurance company. Now extrapolate that over hundreds of millions of Americans who will get these advanced premium tax credits.
There's something I was a little puzzled about, and I want you to straighten out. You've shown me right here how there's going to be a deficit in the medical care that's going to older people. And that deficit they had planned in the taxpayers would have to pay more were to be the young people.
That's right.
And they were going to have to take out policies, otherwise pay a penalty.
Yes.
I understand, and I'm not like you. You're a professional, but I understood that the young people are just going to, since they're well and they can enter this thing anytime they want anyway.
Right.
They can wait before they pay for insurance care. They can wait and just pay the penalty.
Right.
So they're going to pay the penalty instead of the cost of their thing.
That's right.
So that money from these always well young people that's supposed to balance the books for the elderly, not going to happen, is it?
Not going to happen. What you're referring to is community rating.
Community.
Is what?
Community rating. Okay, this is a liberal piece of legislation. It has been implemented in 8 states already. In every one of those 8 states, like New York, it has failed miserably. What it does is liberal legislators walk into a state and they say, we have people over here in the state that are paying more for health insurance than people over here, right? So we want to make it all equal. Everyone should pay the same premium.
Welcome back to Champion News Talk Radio, brought to you by championnews.net. With us today, our guest is C. Stephen Tucker. And Jack, before the break, Steve, you were talking about how Obamacare is leveling the playing field. It's gonna be fair.
Right.
Why is that a bad thing? Fair is a good thing, isn't it?
Yes, and it sounds very fair to those who are not insurance smart, but I'll give you an example of what it has done thus far. These are not new concepts. They've already failed miserably. And community rating has been a failure from the beginning. And here's how it works. You have these legislators, they walk into a state, they say some people over here are paying higher premiums than people over here, so we want to make all premiums in the entire state equal for everyone, right? Which sounds great. Until the young invincibles get a massive premium increase to pay for the people over here. So you've got people who are 25, the young invincibles, right? That we have to get into the Obamacare exchanges or it won't work. Barack Obama needs 2.7 million young invincibles in the exchanges to be able to lower premiums for other people.
Well, they're all the ones that voted for him, so they should be like running in line to get there.
The reality is the cost of health insurance for those people that age are going to be between $3,000 and $6,000 a year. The fine for not purchasing that health insurance is 1% of their modified adjusted gross income. So you take a young person making $35,000 a year. After taxes, the fine to him is going to be about $280 a year.
Oh, now, set me up with the $280.
That's right. Is he going to pay the small fine or is he going to buy $3,000? He's going to pay the fine. He'll never go in the exchange.
But I thought you could be on your parents' insurance until you're 26 years old.
Yes, that's called a failure to launch clause. It does exist, okay? Eventually, you're going to have to buy your own health insurance. This is the target audience that Barack Obama is after, from 27 up, right, until about 35.
So from the beginning, that prevents the young people from getting squeezed.
Yes, because the rate increases go up so high, they cancel their health insurance and pull out of the market. So Barack Obama said, we're going to fix community rating. This time, we're going to make it work. And here's how we're going to do it. We're going to force you unconstitutionally by federal law to buy health insurance whether you like it or not. But if you don't, it's 1% of your modified adjusted gross income.
I know when I was like 24 years old, I got out of the job market and I started my own business.
Yeah.
And of course, when I had a job, I had health insurance. Of course, I didn't make any money,
right.
But my dad was like so worried at that age that I didn't have health insurance.
Yeah.
His company actually paid for he paid to have his company. I was 24, 25. His company provided health insurance for me.
Yeah. Yeah.
So that's nothing new.
Yeah. And there's another reason these kids will not buy this health insurance. There's 3 other reasons. One, employers all over the country, the largest rate of growth in jobs in 2013 thus far have been part-time jobs. 76% of all jobs created in the U.S. in 2013 thus far are part-time jobs. Why is that? Because the employers know that if you're a part-time worker, not a full-time worker, I don't have to pay a fine. Right? So they're pushing everybody down to 29.5 hours. So now they don't even have the money to buy a health insurance plan, so they're going to pay the fine. But they know that EMTLA is still in force. EMTLA is a law that was passed under President Reagan. If you're 250 yards from any emergency room, they have to treat you regardless of ability to pay. And then, number 3, they have 2 times in 2014 where they can game the health insurance industry. From January 1 to 4/1 of 2014, they can buy any health insurance plan from any health insurance carrier with no pre-existing conditions, guaranteed issue, without any proof of prior coverage. Then, after 4/1 on October 7th, they can do it again from October 7th to December 15th. So if you know the fine for not buying health insurance is 1% of your adjusted gross income, you know you can still go to any emergency room for quote-unquote free if you have no money, and you can buy any policy from any carrier in the country twice a year. Why would you maintain a health insurance policy? You're not going to do it. This is why Barack Obama says NBA players, NFL players, tell kids how cool it is to buy Obamacare health insurance. Go out there and tell them. The NFL said, no thanks, we're not going to propagandize for your law. It's not going to happen. So these kids are going to make a very easy decision. $280 a year $3,000 a year. I'm going to go with the $280.
Who's there's vacation money.
Yeah.
Who are the congressmen in Illinois that really need to get some pressure put on them, Steve?
Our Chief Majority Whip, Congressman Roscom, who does not believe in defunding Obamacare, thinks he's going to wrangle enough Democrats to bring it down or it'll implode upon itself, right?
He's from Illinois. He should know better than
You
that.
laid that out. Now, you don't really think that's going to happen the way he's telling you?
Of course not. Of course not. And
Does
listen,
he
if
know?
it happens, great.
Why? Doesn't he know better?
He knows better. Of course he
Why
knows
is
better.
he saying that?
Because they want
John
single
Boehner
payer.
does not want him to risk a government shutdown. We are not the ones asking for a government shutdown. We will fund every function of government in Senator Ted Cruz's amendment, except for funding for Obamacare. These congressmen do not have the courage to do the right thing. And when they do not act in the best interest of their constituents, especially now on September 30th, this is what's going to happen. Millions will lose their health insurance plans, and the largest entitlement in U.S. history will begin. And once those people get that $12,000 subsidy to lower the expense of health insurance, they will never vote against it, ever. And you'll never repeal it. Name the entitlement that's been repealed.
Well, and here's the issue, and this is something we got to keep our eye on, and this is why he's doing everything he can to keep this thing going forward. The success of Obamacare is not important right now. They are taking down private health insurance companies. This whole Obamacare thing is designed to tear down private industry and create a single-payer system.
That's the ultimate goal. Steve, who are the congressmen that have to get pressure in Illinois quick?
Congressman Roscom, Congressman Shimkus, Congressman Kinzinger, and Congressman Schock. The only one who's on our side is Congressman Randy Holgren. The rest of them, we need to burn up their phone lines. We got 7 days left.
Schock, Shimkus, Roscom, and Kinzinger. Make those calls. Stay with us. We're going to have more when we come back. Don't go away. We'll be right back after the break.